So I've been set up quite well by Dr. Witzig in terms of introducing some of the ongoing challenges of understanding the vitamin D literature, which, given it some credit, it won't go away, which tells you there must be something there, but do we fully understand it? And so today's update is to try to give you a sense of where we've come, where we are, and where we might be going. I have no disclosures relevant to this particular topic. And I do want to start with a question. So I can let you read the question. This is a gentleman who's having some difficulty with progressive cognitive decline. He had a general medical evaluation that was unremarkable. Neurology felt he has a neurodegenerative disorder, perhaps Alzheimer's disease, symptoms consistent with that, and he's not taking any supplements. And we have these choices here for what we could do in terms of further evaluation. So go ahead and respond to the question as you feel led. And this particular question is, again, trying to stimulate your thought process. It's not necessarily trying to corner you and come to a particular conclusion. I thought it would be illustrative for all of us to see that there's a variety of opportunities here to evaluate this patient further with the variety of options that I gave to you. I was seeking option number 5, but arguments could be made for any of them. So when I was asked to give this presentation, it occurred to me that some people in the room, so to speak, might not have been in medicine at the time vitamin D became popular. I'm not talking about the 1930s, I'm really talking more like the 1990s. And some of us who are a little bit older, not to name any names, Dr. McMahon, Dr. Hensrud, we can remember kind of where this came from. So I wanted to start by reminding you why this great enthusiasm? Where does this come from? And then as Dr. Witzig did, a little bit more like, if we hold ourselves really accountable for what we do and don't know, what does that actually tell us? That's bullet point number 2. And then point number 3 is actually to kind of maybe reinvigorate ourselves into some of the excitement of vitamin D when we think about the complexity of it, meaning sometimes when we get negative answers, it doesn't mean we have the wrong answer, it just means we're looking in the wrong place.